So what have we learned about our healthcare system over the last year, the year of the COVID-19 pandemic? And of course, the big issue is still around vaccines. We're joined now by Dr. Angelique Coetzee, the chair of the South African Medical Association, and the health systems professor, Alex van den Heerfer. Professor van den Heerfer, if I may start with you, you're at the Wits School of Governance, of course. If I may start with you, I mean, it's obvious, isn't it, that COVID-19 has really shown up the incredible weaknesses in our healthcare system.
Well, there are weaknesses generally within the state, and it's not only within the health system. And I think to a large extent, the health system reflects many of the failures that are prevalent generally. And I think that in itself represents a huge challenge to the concept of the NHI, because in many respects, a lot of the failures of the rest of the state, in fact, reflect designs that are embedded in the national health insurance proposals themselves.
Well, one of the questions to ask about the NHI, Professor van den Heerfer, is if we had had an NHI already, if it had been instituted, say, 5 years ago, would it actually have helped people to get better treatment than they did during the pandemic? I don't know if it's actually possible to answer quite such a complicated question.
Well, so there's, first of all, what conception of a national health system that idea of an NHI represents. Because if we had had a version of the National Health Service in the United Kingdom, which is not anywhere near the proposals that we have for South Africa, we could fare quite well. But the problem is that the national health themselves are so vague and unclear, and involve huge institutional sort of gaps in the institutional framework, that it's absolutely unclear what we would have achieved anything more than what we did now. What we really needed in this pandemic was a well-functioning set of provinces and a national government, and we didn't have that. And it's not about some kind of abstract version of a health system that we should have had. The issue is, why wasn't our health system that we have working very effectively? And that's really the question that we have to answer in the medium to long term. We are not going to get some kind of idealistic version of a health system implemented in South Africa. We've got to build from where we are.
Dr. Angelique Coetzee, I mean, you represent doctors, you're chair of the South African Medical Association. You and your members are sort of inside the system, if you like. Would you agree with that assessment from Professor van den Heerfer? The problem has been, to an extent, within the state and with the way in which provinces are managing hospitals?
Unfortunately, I have to agree with Dr. Alex van den Heerfer. From the medical point of view, you know, it's a systems failure that we are seeing, but it's not only on local level and interprovincial level, but it's also a political failure that we are seeing, especially in the rollout of plans, accountability, understanding, grasping what is needed in the healthcare fraternity. You know, we have been saying how many years that there is big gaps in the system. There are certain clinics that's not functioning properly. And no one actually listened to us, you know. They acknowledge that there's a problem. And we have a very nice tea and cake sort of meeting. Everyone goes back and everyone is happy because we have raised our concerns. But that nothing happens. There's no implementation. And it gets extremely difficult if you want to implement some betterment of the system and you're not affiliated to the parties involving in this. So, you know, we need to, again, who's accountable, who's responsible, who can do the job. We cannot simply in healthcare afford anymore to have cadre do that. Our health system is really falling through the cracks, and COVID-19 as a disease showed us we are faring currently. And if this or let me rather put it like this, if it wasn't for COVID-19, we would have found ourselves in this position with NHI. So in COVID-19 is giving us a good taste of what we can expect going forward if we do not change the system in a more practical way, looking at what the problems are, getting away from political ideas, look at what is at ground level and what is the needs of our population. Our population's got a certain need, and we need to address that need. We need to address the needs of the healthcare doctors, nurses, the system, the buildings. It's just that we are facing with.
Professor van den Heever, I suppose if we look at it from a holistic point of view, and by holistic I mean really from a much sort of high level point of view, it's about the amount of resources, the sheer amount of money we put into our healthcare system, who is treated with that money, and how all of it is managed. So what I'm trying to say is, to put it another way, if we introduced an NHI and we did not increase the amount of money that we spend on the healthcare system, you might get a little bit of an increase in terms of the level of treatment for the majority of the population because of the way the private sector would be integrated. But if I've understood it correctly, if we don't radically increase the amount of resources we put in, we wouldn't actually improve the treatment most people receive. Professor van den Heever, would that be the correct assessment?
Yeah, I think that the problem with health systems is that you've got to combine the efficiency of the system with the resources that you put within it. What you get out at the end of the day depends very much on how the overall system is organized and managed to achieve objectives. So if we had a look at the differential provincial performance, for instance, the Western Cape seriously outperforms the other provinces, but receives essentially the same resources. And so that already indicates that there is an efficiency differential inherent in our public system because of different organizational behaviors. Now, if we wanted to internalize improved behaviors, that has to be our focus, our first focus, because no matter how much money you pour into a system, it will leave that system in criminals if you don't improve the way in which the arrangements are organized. And just to indicate how deep it runs, if you look at the SIU evaluations that have come out on the PPE contracts, they've indicated that they had huge trouble trying to invest these scams and these sort of crooked tenders because the supply chain management in all the provinces that they were investigating destroyed documents, hid documents, did not cooperate. And they had to build a picture from what they could out of what they could obtain. That is already a sign of a broken set of institutions. And I think that if we look at that, it's not just bottom down, sort of bottom up corruption. That is only possible if you're stacking every part of your administration of your health system with people who are part of essentially a conspiracy against the public. And I think that is what we have to. And that you do break. No health system, no well-functioning health system in the world allows this level of political appointment into the system because it institutionalizes patronage as a serving the general public. So that is actually what we have to change. And when that changes, when we add more resources to the health system, get more output.
We're battling with internet connections today, I'm afraid. Dr. Coetzee, I do want to ask you, before we let you go, as chair of the South African Medical Association representing doctors, I imagine you would quite like to see the President tonight announcing at a State of the Nation address when the first people in this country will be vaccinated, because some of them will be your members.
It's true. We would love to see the President speaking about this. But we know that the rollout will take place within the next week or two. And we know that AstraZeneca will be this vaccine that will be used. So what we would like to know is when more vaccines are going to come into the President to address the fact that we should not negotiating with other companies or manufacturers out there if we do not have a good clinical evidence of how that vaccine will fare against our variant that we are currently having in South Africa that was responsible for the second wave. So it doesn't help starting negotiations with other companies, and we know there's not good clinical evidence. We should walk away from this type of behavior. We learned our lessons in the AstraZeneca with data. We need to get the right clinical efficacy data before we start to negotiate. You don't just go and negotiate and jump into the fire. We need to do it differently. We need to learn. And I think we've got a problem with learning. We tend to do the same mistakes over and over and over again. So we would like him to give us the assurance that there would be no further negotiations on products that there's no clinical evidence on the South African variant. That's very, very important. We need that.
Dr. Angelique Coetzee, the Chair of the South African Medical Association. I really appreciate the time. Professor Alex van den Heever, a professor who's very, very involved in research into healthcare systems at the School of Governance at Wits University. Thank you, sir, for your time. Well.